We've got 3 health right patients, all that previously have had health insurance. They are one of over 18,000 patients who seek and receive their health care services through the clinic. And so I just wanted each of them to sort of say a few words about their circumstances, and they've lost insurance, and they are the face of the health right patients and the uninsured.
First of all, I'd like to thank you, Pat. Without this clinic, I would have died, I know, a couple years ago from high blood pressure. I had lost my insurance, I'd paid for it privately, and then all of a sudden it became from $213 a month to $400 a month for private insurance. At that point, I had to make a decision because I like my utilities on my house. I like having the cash that I had to support my home. At that point, I made a decision to stop any type of health insurance. Employer didn't offer it, or too limited amount of employees to be able to afford it. So I didn't have anything. I knew I was getting sick, and I knew I didn't feel good.
I and my husband both are both patients here. I have been, and if it hadn't been for Health Right, I would have lost my husband last year. They see him to several doctors that are absolutely fabulous here, but they need the money and the benefits. My husband spent 33 days in the hospital due to having emergency open heart surgery. If it wasn't for the staff here, there's no way we could afford medicine. One pill alone is over $3,000 a month. He lost his job, I lost my job. I too had to choose food for the house and kids or health care. We need help, and we need it badly.
I had a job, lost it in October, lost my health insurance in November, right before I had to have heart surgery. They did the heart surgery as charity, and then I couldn't get any medicines because I had no insurance. My medicines were over $900 a month. I walked in here, and these people took me in the back, got me my medicines, got me to the doctors I need to get to, and for the grace of God, I'd be dead if I hadn't walked in here.
Well, just very briefly, the Census Bureau issued their report today on the number of insured and uninsured. Nationally, you saw a very slight increase in the number of uninsured, about 600,000 Americans between 2007 and 2008 became uninsured, an increase of 600,000, about 1%. You saw a very different trend in West Virginia, where 17,000 West Virginians were increased in the number of uninsured, about 6.7% versus 1% nationally. So obviously we have a significant problem in West Virginia that we need to solve, and it will take leadership and it will take effort to make sure that we do 3 things, in my opinion. One, we have to reduce the overall cost of health insurance, so those of us who are fortunate enough to have health insurance can maintain it. Secondly, we need fundamental insurance reform so that there's an end to pre-existing conditions, there's an end to what's called medical underwriting, there's an end to discriminatory rates against women. And then third, we need to cover every West Virginian and every American. As a basic human right, every American should have access to health care. So I think those 3 principles need to be adopted both at the state and national level as we proceed with this. But clearly the 17,000 growth in the number of uninsured should be a wake-up call to those who are opposed to health care reform, and make sure that we get on with the effort to get it.
Nora Miles.
Delay in care, not taking the medications properly, and stress related to fear of financial ruin lead up to very serious consequences that were manifested to me in a very compelling way in the report from the Institute of Medicine in 2004, where it was clearly documented. The Institute of Medicine, by the way, is a nonpartisan governmental entity related to the National Academy of Sciences. In their report on the uninsured, the consequences of uninsurance, that in the year 2001, I think they were obviously looking backward, they estimated 18,000 deaths in this country a year, excess deaths related simply to not having insurance. So that's about 200 or more in this state. And that's unacceptable.
I was a little bit disturbed by the new numbers that came out about children's health insurance coverage. We've worked very hard here in West Virginia, everybody from Senator Rockefeller to Governor Manchin to all of us, to get children insured in West Virginia. And it's a little distressing to see that in 2008 there were more uninsured children than in 2007. Not sure what these numbers mean, but anyway, and actually we have an opportunity right now. Governor Manchin could address this problem right now by expanding the children's health insurance program to higher income families, and also by doing away with some of the waiting periods. For example, you have to be uninsured for 12 months to qualify for CHIP if you are above 200% of the federal poverty level. So doing away with some of those waiting periods would address, I think, some of these problems that these numbers exhibit. So I hope that we can continue to move forward in West Virginia. I hope we have national reform. And I just saw that a CBS poll, of a national poll taken on September 1 this year, that says that 82% of Americans say that we need fundamental change in our healthcare system. So if that's not a mandate to our politicians, I don't know what is.
I just want to talk a little bit about a report that we released in June this summer called Health Insurance Coverage in West Virginia Keeps Shrinking as Premiums and Family Costs Continue to Climb. And I think it really segues really into the increased numbers of the uninsured, because health insurance premiums for West Virginia working families have skyrocketed, increasing 75% from 2000 to 2007. The cost of employer-sponsored health insurance in West Virginia is also growing at an annual rate of 8.5%, compared with the 1.8% growth rate for income. So we have a problem here. And also between 2000 and 2007, the median earnings of West Virginians workers increased 19%. During that time, the health insurance premiums rose 4 times faster than income and wages. So we have a very unsustainable situation here, where insurance costs keep going up and employment and earnings are not keeping up. The insurance is becoming more and more unaffordable. More people are not able to get the coverage that they need. And that leads me to making a couple of comments on President Obama's speech last night. I think we really have a historic opportunity to pass comprehensive reform that will give people a choice of a public insurance plan as a guaranteed option with good benefits at a price that they can afford, so that never again in America will anyone have to worry about getting the care they deserve when they need it. So I think we really, these numbers that we're seeing from the census today, the fact that insurance is becoming less and less affordable, it really points to the fact that the private insurance market is failing. A vast number of our citizens here in West Virginia and across the country, and we really do need an alternative program that would help insure everyone.
The point I wanted to make is that these figures are from a snapshot of time in the past, last year, when the unemployment rate was about half of what it is today. So if we can think about what's happening to our neighbors and friends and their children in our communities, the problem is probably double today than what we are reporting on that happened last year. So we have to keep this in mind when we work for healthcare reform and other changes in the community, that the problem is probably worse today than it was when this picture was taken, and it's not going to get better until we all decide to take action. So we really ask our members of Congress to step forward, work hard with the President to pass a health insurance reform package that everybody can be proud of. Thanks.